Hello and very good evening, friends. I hope you can hear me and see me. There's no chat I can see today. Yeah, I can't see the chat anyways. Chalo, anyways, yeah, I see you on the mobile phone, so I'll see the chats on the mobile phone. Okay. So, hello and very good evening, everyone. I hope I'm audible and visible to you all. I hope this is audible and visible. Let us take on. So today, beta, we are going to talk about these important topics, that is occupational health, environment, management, health planning. Any doubts you have, you're very welcome to ask. Let us go with the question number one. So, indicator for vector burden on humans in malaria is, what do you want to say? So you want to talk about vector burden on humans. What is the indicator? Vector burden on humans. What do you think is the indicator? So man biting rate, inoculation rate, slide positivity rate, and human blood index. Vector burden. So it's not talking about the burden of malaria. We are talking about the vector burden. How much is the vector burden? So vector burden indices, vector indices. Wrong answer, beta. This is a wrong answer. Slide positivity rate. It is a wrong answer. No, it's not C. It is not C. It is not slide positivity rate. If you talk about the vector indices, beta. If you talk about the vector indices, the most important index is the inoculation rate. To understand what is inoculation rate is just a simple multiplication of the sporozoite rate multiplied by the man biting rate. It tells you that number of anopheles bite per day per person multiplied by the number of anopheles who have sporozoites. So number of infected anopheles bites per day per person is called as inoculation rate, and that is the most important vector index that we have. It is the biting rate multiplied by the sporozoite rate. Biting rate multiplied by the sporozoite rate. We also have another important index, that is human blood index. These two, which I'm marking as star, these are the only two things which you have to remember for your exam. There are two important vector indices. One of the index that will tell you about how much is the burden of vector like malaria in the area, that is given by the biting that is given by the inoculation rate, which is biting rate into sporozoite rate. On the other hand, human blood index that tells you the degree of anthrophilism, that is number of anopheles who have human blood. So how many mosquitoes are biting humans is called as human blood index, and they both are vector burden indices. If you get both of them in the MCQ, please mark inoculation rate as a much better answer. So inoculation rate is one of the good index. We also have human blood index, both can be true, but B and D both are true. B is a better answer than D. So because inoculation rate tells us how many infected mosquitoes are biting humans. Okay, so inoculation rate is one of the important vector index. Next is intensified malaria control under the national framework for malaria elimination is defined as. What do you want to say? It is defined as. What do you want to say? Intensified malaria control under the national framework is defined as. What do you want to say? Intensified malaria control under the national framework for malaria. API more than one, zero incidence of malaria, no longer 3 consecutive years of no local transmission. So intensified malaria control. When do we say intensified malaria control? Intensified malaria control is called as a category 3 state in which the API is more than one. So it's a very simple direct MCQ. You have to memorize this. This is a factual question that API, if it is more than one beta, it is called as intensified control phase. So there are 3-4 phases: stage 0, 1, 2, 3. Stage 0 is where there is no cases of malaria. This is called as prevention of re-establishment. Category 1, 2 and 3. Category 1 is if the API is less than 1 and all the districts, every district in the state also has API less than 1. Okay, that is category 1. Category 2 is if the API of the state is less than 1, but some districts have less than 1, some have more than 1. Average comes out to be less than 1. That is called as category 2. It is called as pre-elimination phase. So what is elimination phase for a state? Elimination phase is if the API of the state is less than 1 and every district is also less than 1. That is called as elimination state. That is called as elimination state. So what is the best answer over here? You were supposed to mark states with API more than 1. Option A is the best answer. Many of you have marked it correctly. Let us go to the next MCQ. Trends of TB problem in community, including impact of the control measures, is reflected by. What do you want to say? Trend of TB problem in the community, including the impact of the control measures, is reflected by. What do you want to say? Trend of the TB problem in the community, including impact of the control measures, is given by. It is given by what? Option B, option D. Many of you are saying option B and D. Okay. Option C, Ashima, option D. So trends of TB problem in the community. You want to find the trend of the TB problem. You would go with prevalence, proportional, incidence, or all of the above. Many are saying option D, that is all of the above. But if you have to choose one answer, what do you think you're going to choose? You want to find the trend of TB problem. The better answer is not, it is wrong answer is option A, prevalence of suspect cases. Why would you go around talking about the suspect cases? That's a wrong answer. Proportional mortality rate, it tells you about the seriousness, public health impact and seriousness of a disease in an area is given by proportional mortality rate. It is actually a public health panic indicator. You can say that when do people start taking a disease more seriously? When the proportional mortality rate increases. Incidence of new cases, this is one of the most important indicators. It is one of the most important indicators for assessing the trend of tuberculosis in the country. The current incidence is 188 per lakh population for TB cases. So incidence of TB is what is burden of TB, that is trend of TB problem. Incidence of TB cases is the best answer. Old answer, old answer. Some of your MCQ books might say ARTI, annual risk of TB infection, which is the wrong answer, which is now the old answer. We do not take annual risk of TB infection. We take the incidence of the new TB cases. That is the best possible answer today. Coming on to the next one, which of the following statement about poliomyelitis is not correct? What do you think? Which of the following is not correct? Which of the following statement about poliomyelitis is not correct? What do you want to say? What would you say? Option C, VDPV is because of mutations, VAP is because of immune reaction, FIPV is given during poliomyelitis outbreaks, and type 2 vaccine is most easily eradicatable. So absolutely correct, it is not FIPV, it is OPV which is given during the outbreaks. A very frequent question, and I think, I don't know why, during the quiz session which we conduct every day almost, some of the students had doubts regarding the OPV and the IPV. Some of the students had doubts regarding OPV and IPV. Please note that OPV is what is the Sabin strain, IPV is what is the Salk. Salk is what is a killed vaccine. Sabin is what is a live vaccine. It can be given during outbreaks, and this is not effective in outbreaks. FIPV or IPV is not effective during outbreaks. The OPV which we use today, it is a bivalent OPV, and it has two strains, the P1 and the P3. The P2 is not given in the OPV. It is a bivalent OPV. This is a pink color fluid, pink color liquid, which is a bivalent OPV. IPV, it is containing all three strains, P1, P2 and P3. It is also both heat sensitive and freeze sensitive vaccine. It is both heat and freeze sensitive vaccine. Please note, it is both heat and freeze sensitive vaccine. OPV causes both types of antibody production, humoral antibody as well as the gut immunity or the intestinal immunity or the local immunity. So it has both types of immunity, both the humoral, that is the blood, as well as the local immunity or the intestinal immunity. IPV, it causes only the humoral immunity. Now some of the students also had doubts, sir, what is IPV and what is FIPV? See, if they talk about IPV, IPV is different from FIPV. FIPV stands for the fractional IPV. FIPV, beta, it stands for the fractional IPV. IPV is what is a regular IPV. It is given as 0.5 ml intramuscular injection, and it has to be given in 3 doses. This is what is the WHO recommendation. This is what is a WHO recommendation. But we can also give it as 0.1 ml intradermal injection. It can be given in 2 to 3 doses. What we are giving in India is 3 doses. We are giving in India as 3 doses. We give at 6 weeks, 14 weeks and 9 months of age. We are giving in India as 3 doses, and this is what we are following in India, that is a fractional, that is 0.1 ml intradermal dose of the inactivated polio vaccine. So the first two doses, that is 6 weeks and 14 weeks, these are given in the right upper arm, whereas the 9th month is given in the left upper arm. It is given in the left upper arm, and we have discussed this during our session on vaccination. So that's kind of very important for your exam. So FIPV is the wrong answer. It is the wrong statement. FIPV is the wrong statement. VDPV is because of mutations, usually more than 2% change in the genetic makeup of the polio viruses, of the oral polio vaccine. We may land up into VDPVs. vaccine-derived polioviruses. VAP is because of immune reaction. Type 2 is most easily eradicatable. This is also correct. So the best answer you would like to mark for your exam is option number C. Option number C. Please also note that the VDPVs can be of multiple types. Vaccine-derived polioviruses, they can be of multiple types. We can have CVDPV, IVDPV or AVDPV. A stands for the ambiguous VDPV. I stands for the immune deficiency related or associated VDPV, and C is the most dangerous type. C is for the circulating VDPV. Circulating VDPV is highest amount of community transmission, and C is what we are generally very scared of, and these are usually due to mutations because of the vaccine P2 strain. So yes, very nice Ashima, it is because of the vaccine P2 strain. Very good beta, very nice. Let us go to the next one. Which of the following is not correct as a regime for TB preventive therapy? I know it's a difficult question. It was there in the quiz as well, and many of you had answered this wrong answer. So let's try it again. There's another MCQ. Which of the following is not correct as a regime for the TB preventive therapy? What do you want to say? 6 months of isoniazid, 3 month isoniazid plus rifampicin, 3 months of rifampicin, and pyridoxine should be continued as long as isoniazid is given. What do you want to say? So, which of the following is not correct as regime for TB preventive therapy? So, I think many of you have answered this correct answer. So, yeah, absolutely correct, beta. Very nice. It is which is not correct. Very nice. Now you got it correct. Excuse me. So it is 3 months of rifampicin. It is 3 months of rifampicin. It's so hot these days. So going into AC, coming out of AC, it's like big hassle. 3 months of rifampicin. Which of the following is not correct as regime for tuberculosis preventive therapy? 6 months isoniazid, yes, it is given. 3 months of H&P is given. Pyridoxine should be continued as long as isoniazid is given. All are correct answer. This is correct. All are correct answer. The only wrong answer you would mark over here is 3 months of rifampicin. Please note that we can give 4 months of rifampicin. 4 months of rifampicin is given in cases of drug contacts of drug resistant tuberculosis. So in cases of contacts of DRTB, drug resistant tuberculosis, specifically people who have rifampicin sensitive tuberculosis, to the contacts we are giving 4 months of rifampicin. Okay, any other drug resistance, it could be, but this is also always taken as alternate regime. It is the alternate prophylaxis. It is the alternate prophylaxis, that is 4 months of rifampicin can be given. It's not 3 months, it is 4 months of rifampicin. Coming over to the next one, Mr. AB presents with sputum positive pulmonary TB case and was started on ATT on 1st of February 2024. On 5th of April 2024, so just after around February, March, 2 months, he was found to be sputum negative and was started on continuation phase regime. Subsequently, he comes on 30th of June 2024. So it's been February, March, April, May, June, 5 months gone. And sputum tests and is found to be unfortunately sputum positive. So now this patient is sputum positive at around 5 months. He is classified as, what do you want to say? So he is classified as, what do we want to say? Treatment failure, or default, or recurrent TB, or relapsed TB? What do you want to say? So well, absolutely correct. Many of you have got this correct answer. I would just wanted to ensure that you all get the correct answer in your exams as well. It is treatment failure. It is a treatment failure. When do we say treatment failure? Please note that we can have different types of outcomes. We can have something called as TB treatment cured. When do we say cured? When the patient has completed treatment and there is documentation of sputum negative report at the end of treatment. This is direct screenshot from my classes, the things which I write during my classes. So that's why, because it's in different handwriting. So just take it easy. Cured. When do we say TB cured? We'll say that the patient is TB cured when the patient has completed the treatment and there is sputum negative report at the end of the treatment. When do we say completed treatment? We will say that the patient has completed treatment when the patient has completed the treatment, but there is no documentation of the sputum test. There is no sputum test done, or the patient did not report back for the sputum testing. So you don't have a sputum report at the end of the treatment. Next is, when do we say failure of treatment? Failure of treatment is called as two criteria. If the patient is sputum positive even at 5th month, which was there in this case, the patient was sputum positive even at 5th month, irrespective of the previous sputum positive or negative. Or if any time if the patient is, second criteria, or if any time if the patient is sputum positive in a previously sputum negative case, that second criteria also fits in our MCQ. So both the criteria are positive. We don't say double failure, it is a failure. Failure is when the patient is sputum positive even at 5th month, or if any time sputum positive in previously sputum negative case. We can also have a loss to follow-up case. So loss to follow-up is if the patient has started on treatment and discontinued for at least 1 month. At least 1 month. The criteria has been updated. It is now at least 1 month. And recurrent TB is anytime sputum positive after cured or completed treatment. That is what we call as recurrent TB. So absolutely correct answer. This is correct answer, treatment failure. This is correct answer, treatment failure. Next is again, so many times this question has been asked in different platforms, and still students are answering it in a wrong manner. So for a baby exposed to HIV, which of the following is not recommended? What do you want to say? For a baby who is exposed to HIV, which of the following is not recommended? Give nevirapine, not recommended. You have to find the false one. Okay. Give nevirapine for 6 weeks. Give zidovudine if the mother was taking nevirapine based regime. Give nevirapine and zidovudine for 12 weeks if the baby is breastfed exclusively. And breast milk should be given for 6 months and then shifted to cow milk. What do you want to say? Absolutely correct. Please note that whenever we are giving, please note that during, if the child is exposed to HIV, if the child is exposed to HIV, if the child is exposed to HIV, we have the breastfeeding guidelines. Breastfeeding should be continued for at least 1 year. If the child is on replacement feed, if the child is on replacement feed, and they have to be at least for 2 years if the child is breastfed. If the child is exclusively, if the child is, we are talking about breastfeeding. I'm sorry, this guideline. So breastfeeding has to be continued for 1 year if the child is HIV negative, and for 2 years if the child is HIV positive. So that was a small correction. Breastfeeding has to be continued for at least 1 year if the child is HIV negative, and 2 years if the child is HIV positive. So for baby exposed to HIV, which of the following is not recommended? Give nevirapine for 6 weeks. Yes, that is correct. Zidovudine if the mother was taking nevirapine, because there is something called as archived resistance. Beta, nevirapine, it shows some phenomena called as archived resistance. This nevirapine shows archived resistance. Okay, and because of that, if the mother was taking nevirapine to the child, we are not going to give nevirapine, we are going to give zidovudine. Next is option C, give nevirapine and zidovudine for 12 weeks if the baby is breastfed or replacement feed exclusively. Please note that this is the flashcard. So you can find all these list of flashcards on my Instagram channel. So on the Instagram, you can find all these flashcards. This flashcard has been very commonly asked in your exam. It is a 5-star flashcard for you guys. So whenever the child is born, we have to classify if the child is low risk infant or the high risk. In low risk, we are going to give nevirapine for 6 weeks. High risk, we give dual prophylaxis using nevirapine plus zidovudine in India. So in case the child is exclusively breastfed, it is 12 weeks. If replacement feed is given, it is till 6 weeks. Okay, so what are high risk infants? High risk infants are where the mother has not taken ART, or if the ART was taken less than 4 weeks, or newly diagnosed mother within 6 weeks of delivery, the viral load was more than 1000 copies in the mother, or the viral load was not at all done in the female, these children are called as high risk babies. So all vaccines have to be given as per the national schedule, and that's it. That is all that has to be done for the child who is exposed to HIV. So absolutely, beta, the correct answer is breastfeed should be given for 6 months. No, this is wrong answer. This is to be given for 1 year or at least for 2 years. Coming over to the next one, which of the following is not a correct match? What do you want to say? Which of the following is not a correct match? What do you want to say? Rickettsia prowazaki is louse-borne. Rickettsia typhi flea-borne. Q fever is mite-borne. Rickettsia connori is tick-borne. So which of the following is not a correct match? You want to find the wrong one. You want to find the wrong one. What do you think? Which of the following you think is the wrong answer? So which of the following you think is the wrong answer? Absolutely correct. It is Q fever, which is not usually a mite-borne. Q fever usually will not have no vector. If at all in the MCQ, it can be there. Ticks may transmit, but it's not that all the time. Ticks would be reservoirs in Q fever. Generally speaking, Q fevers do not have any vector. They are airborne or they are aerosol transmitted. Q fever is one disease which does not have any vector. You can remember that iPhone Pro is large. You can remember Epic. iPhone Pro is large. iPhone Pro is Epic, right? iPhone Pro is large. iPhone Pro, IP. IP stands for epidemic typhus. IP, epidemic typhus. Prowazaki. Large is louse-borne. Remember, epidemic typhus is prowazaki, which is louse-borne. You can also remember typhoid fleas like endemic, and endemic typhus is a flea-borne. Endemic typhus is a flea-borne. Endemic typhus is a flea-borne. We also have the Orencia tsutsugamushi or the scrub typhus. This is what we call as the scrub typhus, which is mite-borne. You can remember that Orencia tsutsugamushi is there associated with shrubs, and shrub typhus, you can just remember it that way. Okay, and Rickettsia connori, if you want, you can remember it as the Indian tick typhus, which is of course a tick-borne. And then we have is the Q fever. Usually does not have any vector because it is aerosol transmitted. It is from cattle, sheep, goats, and it's a type of zoonotic disease. Love is epidemic. Absolutely correct. Nice mnemonic. Nice way to remember it. If you have any other mnemonics, just let me know. So love is epidemic. Absolutely. Red mite. Why do you say red mite? Like, what is red? Scrub, maybe. Ashima, what do we understand by red mite? Red mite. So yes, Shweta Kumari, there is no rash. Usually high-grade fever without any characteristic typical rash, and there is no vector. It is a Q fever. So let's go to the next MCQ. A patient was admitted with fever and microscopy of the blood smear was positive of Plasmodium falciparum. Treatment recommended as per the revised drug policy. It's a direct question. I don't want any of you to do this as a wrong answer. I want this to be correct for you all. Ashima, mite color red, sir. Oh, red mites. Yeah, red mites. Okay. But that's actually, that could be redwood bugs as well, because they also look like mite. Anyways, I don't want to confuse you just 1 week before the exam. So there's a very typical question. I don't want any of you to mark this as wrong answer. Please try to answer it. What do you want to say? Patient with Plasmodium falciparum positivity. Patient is Plasmodium falciparum positive. What do you want to say? Treatment recommended as per the revised drug policy. Shweta, read it again. Do you want to say, beta, we give artesunate plus sulfadoxine pyrimethamine daily for 3 days? We give all 3 drugs for 3 days? Or we give artesunate daily? Or do you think we give artesunate daily for 3 days and then sulfadoxine pyrimethamine is given only as single dose and primaquine is given as single dose? Which one? Oh, absolutely correct. This is the correct answer. You have to memorize this in your brain, and this is the correct answer. Beta, please note, I think I have not discussed this in the classes, but anyways, if you want to remember that there is a color coded scheme. There is a color coded scheme. It has been discussed in the Marrow videos extensively as such. There is a color coded scheme for malaria treatment. The the malaria blisters, the packets of malaria, the malaria tablet packets which are given by Government of India, they are available in colorful blisters. We have PYGRW, pink, yellow, green, red and white. Pink stands for children less than 1 year. Yellow is for 1 to 4 years. Green and then red and then white. White, please remember, is for adults. White is for adults and pink is for children. If you forget everything, at least you can remember the adult dose. The adult dose for artesunate, it is given as 200 milligram artesunate plus sulfadoxine and pyrimethamine. Sulfadoxine is 750 and pyrimethamine is 37.5 milligrams. Alongside, we also give primaquine as single dose at the rate of 0.75 milligrams per kg body weight. On second day, it's only artesunate, and on third day, it is only artesunate. Plus, on second day, we give primaquine. This is primaquine which is given on the day 2. So please remember, these are the adult color coded blisters for Plasmodium falciparum treatment, and this is what you need to remember. Absolutely correct answer is option number C. I would also like to tell you that what is the dose for artemisinin based combination therapies or for artemisinin derivatives in case of severe malaria. So the artemisinin based combination therapy, you can give it like this, and there's the same which you will give for severe malaria as well. And for all other states except the northeastern states, we use this. For northeastern states, what is the treatment we have? We have the ACTAL. What is ACTAL? That is artemisinin based combination therapy with A and L. What is A and L? It is artemether plus lumefantrine. It is artemether plus lumefantrine. Primaquine is given only as a single dose because it does have an effect. It does have an effect on the hypnozoid stage. It does have the effect on the Plasmodium falciparum parasites, and the primaquine is only given as single dose. It is not given for 14 days. For 14 days, it will have the effect on hypnozoid stage. Coming over to the next MCQ regarding NPSP. Which of the following statement is not true? You have to find the wrong one. Regarding NPSP, which of the following statement is not true? What do you want to say? Regarding NPSP, which of the following statement is not true? Start investigation of AFP within 48 hours. Stool sample collected within 14 days. Within 14 days with a gap of at least 24 hours between the sample. AFP reporting rate of more than one case per lakh per population. Stool should reach laboratory in blue color cold chain boxes labeled as stool sample within 72 hours of collection. Which of the following statement you think is not true? You have to find the wrong one. It's a tricky googly MCQ. Try answering it. Let's see if you can get it right. Let's see if you can get it right. What do you want to say? Which of the following statement is not true? Maybe B. Ashima says B. No, Swapna Ghosh, it's not 48 hours. Soumya Deep says D. Arushi, B, C, B, red box. Akansha Tiwari, very nice. So what do you think is the right answer? Absolutely correct. You've got the color, you've got the code, you've got the answer. Stool should, every answer is correct, beta. All options are correct. Stool should reach laboratory in red color, reverse cold chain boxes labeled as stool sample within 72 hours. Everything was correct. Only problem was with the red color sample, with the red color bag. So red color box, please note this is the only wrong answer. You were supposed to mark option number D. So AFP reporting rate should be more than one case. Please note that AFP, acute flaccid paralysis, it can be because of many other problems. Apart from poliomyelitis, it can also be because of enteroviruses. It can also be because of Guillain-Barré syndrome, transverse myelitis, traumatic neuritis. So AFP can be because of so many things. So we don't want less than one AFP. We want more than one AFP. Please repeat with me. The target indicator or the impact indicator of the NPSP, National Polio Surveillance Program, is AFP reporting rate. This is the target or the impact indicator. AFP should be more than one per lakh population per year. It's not less than one, beta. Okay, option C is wrong. It's correct, beta. AFP reporting rate, Ashima, it is more than one case per lakh per year. So AFP, option C is the correct answer. Stool samples have to be collected within 14 days with a gap of at least 24 hours, and start AFP reporting, start investigation within 48 hours. That is also correct answer. Let us go to the next one. Which of the following statement is not correct? What do you think is the wrong answer over here? Cholera outbreak may have an epidemic tail. Disinfectant with Riedel Walker coefficient of more than 10 should be used. Mass prophylaxis with doxycycline can be done. ORT is the mainstay of treatment and cholera. What do you want to say? Which of the following is not correct? Which of the following is not correct? What do you want to say? So, which of the following is not correct? Cholera outbreak may have an epidemic tail. Yes or no? Yes. This is what we call as the force of infection. This is what we call as the force of infection. Why do we say force of infection? Because do you know that cholera has so many type of carrier stages? Cholera has healthy carriers, cholera has chronic carriers, not chronic carriers, healthy carriers, incubatory carriers, convalescent carriers. So cholera has different types of carrier stages, and the carrier stages are what are maintaining the cholera epidemic in the area. So once an epidemic starts, if the epidemic bursts, now it is very difficult, even if you stop the water supply, now also it is very difficult to decrease the number of the cases, that is to decrease the epidemic. Why is it difficult? Because the carriers will keep on spreading cholera. So this causes the epidemic tail. There is always a tailing phenomena. Okay. Disinfectant with Riedel Walker more than 10 should be used. This is also true. This is also true. Mass prophylaxis with doxycycline. No, you don't do mass prophylaxis. Why? Because just now I told you there are so many carrier stages. Right? Cholera outbreak was the reason of SPM. Yes, that is correct. So mass prophylaxis with doxycycline cannot be done because you don't need mass prophylaxis. It's not recommended. ORT is the mainstay. Yes. Otherwise, the drug of choice, if they ask you, it can be doxycycline. Otherwise, we can use ORT, that is the mainstay. So, which of the following is not correct, beta? Shweta, A and C are correct. Mass prophylaxis can be done. Nah, mass prophylaxis we don't do. Nah. Doxycycline can be given, but it's not used for mass prophylaxis. Okay. So, ORT is the mainstay. It's obviously the oral rehydration therapy in cholera, it has to be done, right? So, option C was the most wrong answer, and this is the one you had to mark. Okay. Let us go to the next MCQ. Which of the following is true for mass drug administration? What do you want to say? Which of the following is true for, which of the following is true for mass drug administration? You have to find the true one. MDA is done with DEC and ivermectin in all the areas. Transmission assessment survey is done in age under 5 years. MDA is done after filariasis survey is done in all age groups. MDA coverage should be more than 50% in endemic zones. Which of the following is true? You have to find the true for MDA. Very nice, Hayat. That was the correct answer to the previous MCQ. So which is true for MDA? What do you want to say? Which is true for MDA? Which of the following is true for MDA, mass drug administration? You have to find the true one. A. No, A is not true. D. Many people say D. Okay. MDA beta, it is a 20 star MCQ. It is almost very important, and almost every exam is going to ask you questions on the mass drug administration. Almost everybody is saying option D, which is wrong answer. You guys जोर का झटका धीरे से लगे. That is what is happening over here. So some students answering A, some are answering D. Both are wrong answers. सुनो अब ध्यान से. What is MDA? I discussed this so many times in the classes, and I always say MDA is very important. Government of India is laying a lot of stress on lymphatic filariasis. We want to eliminate lymphatic filariasis by 2027. Okay. So option B, guess. So A बोल दिया, A is not the correct answer. D बोल दिया, D is not the correct answer. अब B बोल रहे हो, B is also not the correct answer. शाबाश मेरे शेरों, I love you all. Answer C is the correct answer. शाबाश मेरे शेरों, जो चीज़ नहीं लगता वही आंसर होता है. That is how it happens, है ना? The answer which you think is the least probable, that is the one which is going to happen. Let us have a discussion, quick round of discussion. I think only one student, Chandya Anbarasan. Chandya, you were the only one who answered it before I told it. Now so everybody will answer it. Suparna, Akansha, very nice. So it is option C. It is option C. जो बच गया वही आंसर है. क्लास में भी तुम लोग ऐसा ही करते हो. So whatever is left out, that is the answer, है ना? Yeah, obviously googly that. So okay, look at the screen please. Look at the screen. Let's have a quick discussion about MDA. Beta, MDA, point number 1. MDA we do using, MDA is done using 3 drugs, I, D and A. Ivermectin, DEC and albendazole. It is done using 3 drugs, ivermectin, albendazole and DEC. Right? DEC. So A is false. A is false. Transmission assessment survey is done in children under 5 years. No, it is done in 6 to 7 year age group. It is not done in under 5 years. It is done in age more than 5 years. Usually 6 to 7 year early school going children are taken. So B option is not correct because it is done in children age 6 to 7 years. The MDA coverage should be more than 65% beta. It should be more than 65% in the endemic zones. We generally try to keep the MDA coverage to be more than 80%. 80% is our target. We target is to achieve 80% coverage, but generally it should be, if you get single best answer, it should be beyond how much number, it should be more than 65%, the MDA coverage. So if you just read, these are the guidelines by the Ministry of Health and Family Welfare, and these have been taken from my book, textbook, Conceptual Review of Community Medicine, and this is how we eliminate lymphatic filariasis. So lymphatic filariasis should have at least 65% coverage. We do 5-6 rounds of mass drug administration. The children age group is 6 to 7 year children. And how do we do? The transmission assessment survey is done. Transmission assessment survey is done using serological test. It is done using serological test. So MDA, regarding MDA beta, MDA is done, if you talk about the mass drug administration, the MDA is done after conducting the LF survey, lymphatic filariasis survey. You do a survey, it is done in 4 sentinel sites and 4 random sites, collecting total 4,000 slides are taken. In those 4,000 slides, we will find out the average infestation rate, we will find out the microfilaria rate and so on. So after doing a survey, we will give the mass drug administration. This mass drug administration has to be done for at least 5-6 years, for at least 5-6 rounds, and then we do the transmission assessment survey. Okay, and then we do the transmission assessment survey, and this is what the question was. So how do we tend to eliminate? Our target is to eliminate lymphatic filariasis by 2027. When will we say elimination? Elimination is when the microfilaria among those 4,000 slides, you remember 4,000 slides in children 6 to 7 year age, if the 4,000 slides 6 to 7 year age children is showing lymphatic filariasis less than 1%, we will call this area as lymphatic filariasis eliminated area. So that is the reason Government of India is going pretty strong with the lymphatic filariasis elimination. We do a survey, we give mass drug administration, then we do a transmission assessment survey, again we give mass drug administration, again we do transmission assessment surveys, till the time we don't get a microfilaria rate of less than 1% in the children age group. So that is what you need to remember for lymphatic filariasis. It's pretty important, 20-star MCQ. Coming to the next one, 35-year-old female is reported to have faint line-like acito-whitening at the junction of the squamous and the columnar epithelium on the visual inspection with 3 to 5% acetic acid. This is a pure gynae question. If you want, I can just skip this question, the discussion of this question. But if you give me just the right answer, it's a very simple, direct gynae-based MCQ. So which of the following is the next step? Less than 1% beta, not per 10,000. Less than 1%. Ashima. So 35-year-old female is reported to have a faint line-like acito-whitening at the junction of this epithelium on inspection with 3 to 5% acetic acid. What do you think is the next best step? Refer the female for cryotherapy, for pap smear, follow after 1 year, 5 years. What do you want to say? So it's a pure gynae question. If you want, I can skip. Many students are answering option number B. Many students are answering option number B. So many students are answering option number B. What do you want to say is the correct answer? B. Okay. Okay. Please note that why do you say B? Because you have to refer the female for biopsy and pap smear. That is what you guys are saying. Unfortunately, every one of you has given this as wrong answer. Everyone has given a wrong answer. It is not B. जोर का झटका धीरे से लगे. Screen and treat approach. A. Shweta Kumari. Sri Chandana. D. Reproductive age group 1 year follow up if then positive again. Okay. Please note, you guys are wrong. Some are saying A, some are saying B. Mostly people said B, and some are saying C. C and treat approach. Very nice, beta. Very nice. This is correct answer is option number D. जोर का झटका धीरे से लगे. This is pure gynae question. It has to be followed up after. नहीं, it has to be followed up after 5 years. जोर का झटका धीरे से लगे. So when we do, beta, I hope you all know that the screening test. I hope you all know that the screening test of choice for cervical cancer, that is 3 to 5% acetic acid. Acetic acid. It is visual inspection with acetic acid. Screening test of choice for cervical cancer, it is visual inspection with acetic acid. It is not pap smear. Okay. So if you look at this acetic acid, beta, if you look at the acetic acid on the cervix, you can see over here that there is when will you say the VIA is negative? When will we say that the visual inspection with acetic acid is negative? We will say it is negative when there is no aceto whitening area, or the edges are very clean and demarcated, right? So there is no aceto whitening area in the cervix. Now, in case of applying acetic acid, if there is a discrete margin over here, you can see a margin over here, right? This one is with Lugol's iodine. if you see a discrete margin, it is called as a positive on visual inspection with acetic acid. So when do you say negative beta? We will say that the test is negative when there is no aceto-white lesion. We will also say when there is faint aceto-whitening at the junction of the squamous columnar epithelium. So if there is faint aceto-whitening, it is not positive. I repeat again, if there is faint aceto-whitening at the junction of the squamous and the columnar epithelium, it is not taken as a positive VIA. It is taken as a negative VIA. Right? It is taken as a negative. When do you say positive? Positive is when there is definite aceto-whitening far away from the transformation zone, and the margin is well defined. They are may not be raised. There is distinct opaque aceto-white area. Okay. Invasive cancer is when you see the growth. So now what to do in these cases? When the VIA is negative, this is algorithm for screening and management of cervical cancer by Ministry of Health and Family Welfare, Government of India. 2017. These are the 2017 guidelines which have not yet been updated. So if the patient is VIA negative, you have to repeat the VIA after 5 years. You have to repeat the VIA after 5 years, and if the VIA is positive, then we have to refer the patient to the gynecologist, and they will do cryotherapy or colposcopy, and then they will do the grading of the cancer and so on. Okay, so please note that if the negative VIA is there in rural areas, the guidelines, Government of India guideline is to repeat VIA after 5 years, right? और सर HPV टेस्टिंग तो नहीं बोला, या नो HPV टेस्टिंग HIV pap smears if only then. Yeah, in Government of India we don't have HPV testing. We only have the cervical cancer testing using visual inspection with acetic acid. That is the most basic screening test. After this, the patient goes to the gynecologist. Gynecologist can do HPV screening, DNA testing, double-stranded DNA or whatever, right? So if it was positive, then you will have to refer to the gynecologist, and the patient will have to be assessed if they are if the cryotherapy can be done or not be done. I think it's there in the options. Lesions eligible for cryo or not eligible for cryo. This, I think, this is the part which you were talking in gynecology, right? But this is the part which is important from community medicine point of view, that when to send the patient to the specialist, when to send to the specialist. These are not WHO guidelines, Vidushi. These are Government of India, Ministry of Health and Family Welfare, Government of India 2017 guidelines. They have not yet been updated after that. These are the only guidelines that we have for cervical cancer screening in India. Okay, so this is not the FOGSI screening guidelines or the WHO screening guidelines. These are not what the private practitioners or the gynecologists would be following. This is what is being followed in the public healthcare system in India. So if nothing is mentioned, you are free to use these guidelines. But of course, if they mention that the patient is having something else, or they refer to some other clinic, and the female is not in rural India, then you go with your gynecology guidelines. I hope it does not create any confusion. I hope it clarifies. Is it okay for everyone? Can we move ahead? Is it okay? Today I think I'm discussing a lot of MCQs, and we need to pace up, and we need to finish the session on time as well. And is it okay for everyone? Let's pace up and let's go towards a few other MCQs. Orthotolidine test is used to determine what? Nitrates in water, free residual chlorine in water, free and combined chlorine in water, ammonia content in water. Orthotolidine test is going to tell what? Orthotolidine test is for, it is for, absolutely correct beta, orthotolidine test is used to check for chlorine in water, free and combined chlorine in water. Please remember, there are two tests. We have the orthotolidine test and the orthotolidine arsenate test. The orthotolidine test will tell us about the free and combined chlorine together, whereas the orthotolidine arsenate will tell us about the free, orthotolidine arsenate test will tell us about the free and combined chlorine, free and combined chlorine. Oops. So there we have this issue again. Yeah. Orthotolidine arsenate test will tell us about what? It will tell us about the free and combined chlorine separately. It will tell us about the free and combined chlorine separately. That is what is the orthotolidine arsenate test. Absolutely correct. Who will tell us about the chlorine demand? Any idea? Chlorine demand, please write it in the chat box. Chlorine demand is given by what? Chlorine demand is given by, I think many of you must be already knowing it, Horrocks apparatus. It is given by Horrocks apparatus. Chlorine demand is given by Horrocks apparatus. How much is the level of chlorine? How much should be the level of chlorine? The level of chlorine should be always more than 0.5 parts per million after a contact time of more than 1 hour. After a contact time of more than 1 hour, the level of chlorine should be more than 0.5 parts per million. Absolutely correct. So flow of light or luminous flux is measured in. Flow of light or the flux, luminous flux is measured in lumens, lux, luminescence or Lambert. What do you want to say? Very nice, bache. Everybody doing good. Flow of light or the luminous flux is measured in. Flow of light or the luminous flux is measured in. Absolutely correct. The correct answer is lumens. It is not lux, Suparna. It is lumens. Very nice. So Shweta Kumari, absolutely correct. Flow of light is measured or luminous flux is measured in lumens. Please remember, this is again a 10-star table. Very frequently it has been asked in your exam. Nothing much. It is just very frequently asked question. So please note that the brightness of the point source, brightness from the candle, if any light is there, if let us say this thing is there and this is illuminating some light, if the light is there, so how bright that light is. If the light is there and this is 200 watt bulb, so how bright the bulb is, 200 watt, 100 watt, 80 watt, how bright the bulb is, that is what we call as brightness of the point source. It is measured in candela. Next is the flow of light. Flow of light is measured in lumens. Don't confuse flow of light or flux with the lux. Flux is flow of light and luminous flux will be given in lumens. That is the reason very frequently people will be asking you and they will try to trouble you a lot. You will have to memorize that luminous flux is not in lux, it is in lumens. Next is how much light reaches surface. That is what is the best measure. It is most important measure. It is one of the most important measure. It is one of the most important measure to find out the light. It is most important measure to find the light in the area. It is the amount of light reaching the surface. And last is the amount light re-emitted. Remember Lambert is re-emitted. Okay, Lambert is re-emitted. Yeah, flux is not lux. And illumination is not luminescence. Luminous intensity is separate. And brightness luminescence is Lambert's. Okay. So please note that flow of light is measured in lumens. Next is, which of the following is not true for the Rajiv Gandhi Shramnik Kalyan Yojana? Many students had doubt on this Shramnik Kalyan Yojana. So many students said that we are hearing it for the first time. Yeah, it's a cross mnemonic. So now you have a name for mnemonics also. You have straight mnemonics, cross mnemonic. वेरी नाइस। आशिमा गुप्ता, मतलब इतना आपने पीएचडी कर रखी है निमोनिक्स बनाने में ना। So there is a mnemonic, then there is a cross mnemonic, and then there is a mnemonic to remember the mnemonic. Kamal hai, hats off. Which of the following is not true for Rajiv Gandhi Shramnik Kalyan Yojana? Bolo shabash, kaun sa hai? Eligible only if the insured is more than. Which of the following is not true? Not true batana hai. Eligible only if not insured and contributed for more than 2 years. Eligible in case of retrenchment or permanent invalidity or COVID 19 includes employment allowance of up to 50% for maximum up to 2 years. Has replaced the earlier Atal Bimit Vyakti Kalyan Yojana. तुम लोग मतलब you don't hear to the telegram audio sections है ना, मतलब मेरा ऑडियो पे बोलना सब बेकार है if you are still answering the same old answers. So what did you learn if I had told in audio lectures? If you would have listened to the audio explanation of the quiz, you would have answered this correctly. These questions are going to define whether people will be in Department of Biochemistry or Microbiology all their life, or they'll be Department of Radiology or Dermatology. These are simple questions. You can't afford to get these questions wrong. These questions I have told you in quiz. I gave the right answer in the quiz. Then I give you the audio explanation in the quiz, and then I conduct a YouTube session, and again students will answer the same wrong answer. And this is not very nice. This is not very nice. So please note that Rajiv Gandhi Shramnik Kalyan Yojana. Beta, exam is on your head. You have to be serious right now. Which of the following is not true for the Rajiv Gandhi Shramnik Kalyan Yojana? Eligible only if insured and contributed for more than 2 years. Yes, that is correct. It is true. Eligible in case of retrenchment, permanent invalidity or COVID-19. Yes, this is true. Option C includes unemployment allowance for 50%. Yes, this is true for up to 2 years. This is also true. So it does not replace, beta. It does not replace. It does not replace. It has not replaced. Atal Bimit is still there, and option D is the false answer. Please note that Rajiv Gandhi Shramnik Kalyan Yojana, many students had doubt on this. This is under the ESI program. If you want, you can just go to the ESI website, search, Google this word Shramnik Kalyan Yojana or ESI Shramnik Yojana. Just Google it. You will get direct to the link. So it is unemployment allowance which was introduced in 2005 to all the people who were unemployed and after being insured, and they were contributing for 2 years before their unemployment. Now in these cases, if they are forcefully asked to leave the company, like retrenchment means they were just laid off, or closure of the factory or establishment, and permanent invalidity due to non-occupational injury due to non-occupational injury, in those cases they can avail 50% of wage for period of up till 2 years. This is unemployment allowance which is given to these people. During these allowance, if they were just laid off because of their skills were lacking, they can do vocational training, medical care is being provided. Okay. Atal Bimit Vyakti Kalyan Yojana. Atal Bimit Vyakti Kalyan Yojana. It is unemployment relief. It is again 50% of wage given for 90 days, and it is availed once a lifetime. Once a lifetime. And this is separate from Rajiv Gandhi Shramnik Kalyan Yojana. It is availed once a lifetime. Okay, it is availed once a lifetime. It is separate scheme. So please note, you can't afford to get these questions wrong. I've discussed this so many times in the quizzes, in the apps, everywhere. I've tried to give you information on this. ESI everybody knows better, but these are some things which make the paper hard, and if you know the answer of these questions, then of course you stand a much higher chance of getting better ranks in your exam. Coming to the next one, the instrument shown in the diagram is used as, what do you think is this? Air pressure, air humidity, radiant heat, or cooling power? What do you think is this? The instrument shown in the diagram is used for. The instrument shown in the diagram is used for. What do you want to say? The instrument showed in the diagram is used for. It is used for air humidity, air pressure, radiant heat, or cooling power of air. Please note it is used for radiant heat. This is what we call as a globe thermometer. This is what is a globe thermometer. It is for radiant heat. You can take a screenshot of this page. You can take a snapshot of this page, and this is a 5-star MCQ table. Every year you get a lot of questions on this. Which of the following instruments, and on the other hand you have is the what we do with this. So please note, temperature we use as thermometer, air pressure is barometer, radiant heat is globe thermometer. That is what was shown here right now. Milk density lactometer. Due to any other solid fat substances apart from fat, it is solid non-fat testing. Pasteurization, water quality, lot of questions come from this table. So you can just take a screenshot of this table, and it will be helpful for your total environment chapter in your exam. Total chapter on environment will be based on this, so it might be kind of helpful for your exam. Coming to another MCQ. This mosquito has spotted wings and causes a parasitological disease. All of the following are features of this mosquito except. What do you want to say? So this mosquito has spotted wings and causes a parasitological disease. Breeds in clean water. Boat-shaped eggs. Lateral floats. Eggs are laid in cluster and rafts. Larva does not have siphon tube. What do you want to say? What do you want to say? Which is the best answer? This mosquito has spotted wings and causes a parasitological disease. So identify this mosquito. All are true except you have to find the false one. So what do you think? Eggs are laid in clusters and rafts. Absolutely correct. I think many of you are answering this as the correct answer. This is the correct answer. Please note, the mosquito has spotted wings. We are talking about Anopheles mosquito, and causes a parasitological disease, and of course we are talking about malaria. Okay, all of the following are features of this mosquito, Anopheles mosquito. So absolutely correct, beta. If you want, you can take a screenshot of this page, or very frequently we get questions from this. So what is the breeding site? What is the breeding site? Egg, larva, adult flight range, sitting posture, and wings. These are classical direct MCQ based questions. You can take a screenshot of this, and this is again a 10-star MCQ table frequently asked in your exam. So please note that the larva egg of the Anopheles, it is boat shaped with lateral floats, and these are single eggs. They are not multiple eggs. They are single eggs, and the larva is near to the surface. So absolutely correct, beta. Eggs are laid in clusters and rafts. This is wrong answer. It is in single eggs. It is single boat-shaped eggs. Very nice. Very, very nice. So this is again, you can take a screenshot of this. This is again a 10-star high yield table. You can take a screenshot of this, what all diseases and what all vectors are there. A lot of times students have confusion on this, specifically talking about KFD. Kaizenor forest disease, please note it can spread by soft tick, or it can also spread by hard tick. In India, how does KFD spread? Kaizenor forest disease in India, it spreads via hard tick, but in many countries, soft ticks are also known to transmit Kaizenor forest disease. But if you get single best answer, please note hard tick is the best answer. Next is regarding Q fever. Q fever generally will not have any vector, but if nothing is mentioned, or if you have to choose out of all the vectors, you can choose soft ticks. Soft ticks can be the reservoirs for Q fever. Q fever generally is not having any vector. I repeat again, Q fever, I do not want to create confusion. It has no vector. But if you want to mark the single best answer, you are there in a problem in the MCQ, then you can go ahead with the soft ticks. Then you have cyclops, itch mites, and I think everybody knows about all these other ones. So these are all the entomological insects and the disease. I think this is the very high yield table. It should be posted as a flashcard. I will post this. This is what you need to remember for your exam. Coming to the next one, prevalence of microfilariasis in the population is given by. Again, a question on lymphatic filariasis. What do you think is the best answer? The prevalence of microfilariasis. The prevalence of microfilariasis in the population is given by. What do you want to answer? Is given by microfilaria rate. This is again a 5-star MCQ frequently asked in your exam. So microfilaria rate, filarial endemicity rate, microfilaria density rate or average infestation rate. Prevalence of microfilariasis in the population. Prevalence of microfilariasis in the population. So please note that the prevalence of microfilariasis in the population is given by how much average number of microfilaria per positive slide, each slide from 20 cubic millimeters of blood. This is average infestation rate. It is the prevalence of microfilariasis in the population. Okay. Microfilaria rate, it is endemicity indicators. It tells us how much is the prevalence of filariasis. Endemicity indicator and prevalence of filariasis, microfilaria rate, microfilaria rate. So microfilaria rate, filarial endemicity rate, prevalence of microfilaria or disease, both. So filarial endemicity rate, beta, it tells us about the burden of filariasis in community. It tells us the burden of filariasis in the community, that is filarial endemicity rate. Filarial endemicity rate. But please remember, prevalence of microfilariasis. Density is for one person. Absolutely correct. Density is for intensity in individual. Microfilarial density is for one person. But average number of microfilaria per positive slide, each slide being made from 20 cubic millimeter. So average number, it tells us about the average infestation rate. Okay. So the best answer over here is microfilaria rate. Microfilaria rate will tell us about the prevalence of microfilariasis in the community. So out of all these, please note that prevalence of microfilaria in the community, prevalence of microfilaria in the community is given by microfilaria rate. It is given by, the best answer is microfilaria rate. Okay. Average infestation rate, it will tell us about the burden of microfilaria in population. Density is burden or intensity. Burden or intensity of infection in an individual. And microfilaria rate is what is the prevalence of microfilariasis in the community. Okay. This is again frequently asked in your exam. Last MCQ, I think just 1 or 2 MCQs more. Find the incorrect match. Which of the following you think is the incorrect match? From international health, which of the following you think? Yes, PA, all are looking same. They all look to be the same. Find the incorrect match. Rockefeller Foundation, establishment of All India Institute of Public Health and Hygiene, Kolkata. Ford Foundation, rural toilets, rural development sanitation toilets. WHO, ICDS program, midday meals. New Zealand, grant for establishment for AIMS, New Delhi. So which of the following is incorrect? You have to find the incorrect one. Which of the following is incorrect? I think you all have got it right. It is not WHO. Very nice, beta. I'm proud of you. I thought some students will get into this googly, but you all are learned students now. It is UNICEF. It is UNICEF. This is the correct answer you were supposed to mark. It is UNICEF. So please remember, I will tell you a way to remember Rockefeller. Remember Rockefeller. K stands for Kolkata. So Rockefeller worked in Kolkata. Remember, in Kolkata we have the All India Institute of Hygiene and Public Health, AIIHPH, All India Institute of Hygiene and Public Health, and this is Kolkata. Rockefeller, K is for Kolkata. Ford Foundation, remember Ford Foundation worked for toilets, and sanitation. It was for toilets and Ford Foundation. UNICEF is for ICDS program, midday meals. New Zealand worked for, they gave a grant for establishment for All India Institute, New Delhi, under the Colombo plan. Okay. So please remember a few more points about international health. SIDA works with what? Swedish International Development Agency. SIDA works with Swedish International. They work for TB program in the country. Bill and Melinda Gates again work for TB program in the country. They also work for rural development. The Colombo plan was in 1951. They gave us the cobalt teletherapy units. And the Colombo plan also gave us the grant for All India Institute of Medical Sciences, New Delhi. Remember, All India Institute of Medical Sciences was given by the grant from New Zealand. And cobalt therapy units was from Canada. And these all were under the Colombo plan. DANIDA, Danish International Development Agency, they work for our blindness program. DANIDA. NPCBVI is for DANIDA, or the Danish International Development Agency. Okay. So Parna Ghosh, last question, average infestation would be the answer. Na sir, as per table. Please note, yes, I agree. This is written, but this is not very accurate. You can just finish this off. Please note that intensity, burden of microfilaria in the population is average infestation rate. So it tells you how much is the intensity of microfilaria in the population. Okay. It is not the prevalence of microfilaria. Prevalence of microfilaria is given as the microfilaria rate. Microfilaria rate will tell us about the prevalence of microfilaria in the population. Okay, so Parna, Prachi, that was just for your doubt. Average infestation rate will just tell us the average number of microfilaria per population, per positive slide. Na? So if there are 10 positive slides, out of the 10, what is the average number of microfilaria? It will tell us about the burden of microfilaria in the community. But burden of microfilaria in one person is given by the density rate. Microfilaria rate will tell you how many percentage of people showing microfilaria in the blood. Simple. So if this is the total population, out of them these many people have microfilaria, so that is the microfilaria rate. Okay, did you get this? Microfilaria rate, prevalence of microfilaria in the area, right? Okay. Chalo. Which of the following is not correct? Which of the following you think is not correct? Didactic is two-way communication. Delphi is a method of group discussion. Cafeteria is approach for family planning methods. Satya approach is used in RKSK. What do you want to say? Which of the following is not correct? Which of the following is not correct? Didactic is two-way communication. Delphi is a method of group discussion. Cafeteria is for family planning. Satya is used in RKSK. Very nice. You all remember from the classes or from anywhere where you have studied, didactic is not a two-way communication. Didactic is one-way communication. Very nice. Socratic is a two-way. Socratic is a two-way communication. Absolutely correct. A is the correct answer to be marked. Delphi, it is a group discussion to solve complex problems. Cafeteria is for family planning methods. That is, the choice of contraception is on the client. The choice of contraception is on the client. Satya approach is used in RKSK. What is RKSK? Rashtriya Kishore Swasthya Karyagram. Next, Seminar is for smaller groups. Which of the following is not correct? You have to find the wrong one. Okay. Which of the following is not correct? Seminar is for small groups. Symposia does not involve discussion among the experts. Panel discussion is series of lectures. Role play is a group method. What do you want to say? What do you want to say? Which of the following is not correct? Obviously, I think many of you must have got this correct. Answer that panel discussion. It is discussion among the experts. Okay. So definitely C is the wrong one. So one of the student had asked, what is the difference between a conference and a focus group discussion? Beta, nothing much. It's a very simple point. That what is conference? Conference is usually on a theme, and conference is to share intellect, ideas, and methods, research methods. That is what is called as conference. So we will do a conference today, and it is usually involving a large population, large group, and they register for the conference. They are like registered people of the same intellect level. You can't have a conference on HIV AIDS by having labor class people from the road coming to the conference. That won't work as a conference. So conference is same type of people, intellectually same. You can't have a conference on HIV and taking people, participants as forensic medicine people. Are you getting it? So if there has to be on a topic on forensic, it has to be on forensic. If there's a gynae topic, there have to be people with the same intellect level, with common interests, large group. They will register, share the intellectual ideas and the research methods, and it is usually on a theme. Focused group discussion is only with 6 to 12 members, beta. It is only with 6 to 12 members, and these members will sit together. So member number 1, 2, 3, 4, 5, 6, 7, and these members will talk with each other. They will talk with each other. Are you getting it? Everybody will talk with each other. Everybody will talk with each other, and everybody is going to be, some person will be there, and this one person is going to write down notes. He will write down the notes, who is talking and what are they saying. So this funda is what we called as a focus group discussion. Difference between chalk and talk versus demonstration. Demonstration is for generally showing a skill. Demonstration, if I have to teach you how to do a cardiopulmonary resuscitation, if I have to teach you how to do a cardiopulmonary resuscitation, beta, sorry. If I have to teach you that how to do a cardiopulmonary resuscitation, then I will first have to demonstrate the skill to you. So usually demonstration is for a skill. If I have to tell you demonstration, it is for making or showing some skill, like how to make ORS, how to do cardiopulmonary resuscitation. Our demonstration is how to do physics, exercise, how to solve a numerical. So it actually works on your cognitive and a psychomotor skill, more on cognitive rather than a psychomotor. So it gives you the knowledge component of doing a skill. That is what is a demonstration. Chalk and talk is nothing but I will just chalk and talk. It is usually just not a very specified measure, and it is more only of a cognition rather than a psychomotor at all, right? So that's the things. These are some of the things which you were asking about it. Right? Last question. Let's just have this last question as well. Sociogram. Sociogram is what I had shown over here. But a sociogram is how people interact with each other. That is what we call as sociogram. Last question, which of the following is not correct? Srivastava committee is known for providing the criteria for poverty lines. Kuppuswamy scale is for urban area, Uday Parekh for rural area, BG Prasad is based on annual price index and income. What do you want to say? What do you want to say? Which of the following is not correct? Which of the following is not correct? Any idea? Srivastava committee, or Kuppuswamy, Uday Parekh, BG Prasad. Yeah, most of you are answering the correct answer. Srivastava committee is not for the poverty lines. Srivastava committee is not for the poverty lines. Srivastava committee is for referral for planning for the referral services. Srivastava committee also worked on medical education, reorientation of medical education. It is called as Rome scheme. Beta, the providing the criteria of poverty line, that was done by the Tendulkar committee. And then the different scales and how to talk about the poverty lines, it was also done by the Ranga Rajan committee. So the Ranga Rajan committee and the Tendulkar committee, they worked on the poverty line. Srivastava committee is for providing the referral services to the population, right? Referral services. Kuppuswamy is for urban area, true. Uday Parekh is for rural area, this is also true. BG Prasad scale is based on the API, annual price index, and the income, this is also true. So option A is the only one which you are supposed to mark as the wrong answer, and that is the only one which you were supposed to mark as your answer. And with that, thank you so much for joining in the session today. Yes, poverty line is below 2100, Ashima. So that was regarding most of your high yield questions from this area, and it's already quite late now. And any doubts you have, anything you want to ask? Anything you want to ask? Beta, as you can see, this is the Instagram, and all those students who have not joined the quiz, they are very welcome to join the quiz on the Telegram. You can see the Telegram link as well, and the Insta link as well. And Uday Parekh does not include income. It actually does not include income. It includes the commodities which we purchase with that income, right? So I'm not sure if there would be any other session at all, because the exam is just around the corner. But as per the schedule, let me just see if the schedule is there, Andy. Yeah, I have the schedule. I think we are live again on 7th of August before your exam. So last session, one more session is pending, beta. It is on 7th of August, and that will be, sir, your YouTube video enough for December FMG? नहीं, ऐसा नहीं. Yeah, it always becomes so hodgepodge at the last, beta. In the last times, it's always so hodgepodge that it is usually very difficult to keep a very sane mind and be able to perform. You know? It is very important to stay in the safe mind. वो कहते हैं ना, some yeah, revision videos. FMG बेटा it's already there, Sing 1996. FMG के sessions it's already there. It's already there online. So you can just search this video, this YouTube channel only. Right? वो कहते हैं ना कि सूरज सा तेज नहीं मुझ में, पर फिर भी दीपक सा जलता देखोगे। सूरज सा तेज नहीं मुझ में, दीपक सा जलता देखोगे। अपनी हद रोशन करने से तुम मुझको कब तक रोकोगे, तुम मुझको कब तक रोकोगे। मैं उस माटी का वृक्ष नहीं, मैं उस माटी का वृक्ष नहीं जिसको नदियों ने सींचा है। मैं उस माटी का वृक्ष नहीं जिसको नदियों ने सींचा है। बंजर ज़मीं को फाड़ कर मैंने मृत्यु से जीवन सीखा है। मैं पत्थर से लिखी इबारत हूँ, शीशों से कब तक तोड़ोगे। मैं पत्थर से लिखी इबारत हूँ, तुम शीशे से कब तक तोड़ोगे। अपनी मिटने वाला मैं नाम नहीं, तुम मुझको कब तक रोकोगे। अपनी हद रोशन करने से तुम मुझको कब तक रोकोगे, तुम मुझको कब तक रोकोगे। So I hope you just get on to the stuff for your exam, and I know it's always so hard to maintain your peace of mind in the last 1 week or 10 days before the exam. But beta, just think of this. मैं खुद when I was doing my PG entrance की preparation, I also used to get the same problem, right? Everybody has gone through these phases. इसमें ये होता है ना कि these last 10 days are going to define so many things for us. So you have to stay a lot focused over here, that you are not to be distracted that what is going to happen after the exam. उसकी चिंता कभी नहीं करनी कि एग्ज़ाम के बाद यार जब मैं बहुत फ्री हो जाऊंगा या हो जाऊंगी, आई विल ओपन माई हॉस्पिटल, आई विल गेट इन टू डर्मेटोलॉजी ब्रांच या रेडियोलॉजी, मैं ये करूँगा या ये करूँगी, या कई दफ़ा नेगेटिव थाट्स आते हैं. So promise one thing, that you will not waste your time. There's absolutely wastage of time that after my exams I'm going to do what, because that what could be positive or negative. So don't waste your time कि यार एग्ज़ाम के बाद जो होगा देखा जाएगा. मुझे 10 दिन एग्ज़ाम के लिए I have to do my best. अभी एग्ज़ाम के लिए we just have 10 days, right? So 10 days I have to be hell lot focused, so that I don't have any distractions. What is going to happen after the exam, what will be my marks, score क्या आएगा, वो सब चिंता छोड़ो. 10 दिन सिर्फ कर्म हमारा फल होगा. कर्म में अगर सच्चाई है तो हर कर्म कहाँ निष्फल होगा. हर संकट का हल होगा, वो आज नहीं तो कल होगा. Okay, so कर्म किए जाए. You just have to keep on working over here. And the time you will realize that you will keep on working over here without thinking about the outcome, then you will get the level of perfection that you actually wanted. So I would say that there's pure wastage of time when we think about outcomes, that what is going to happen, what is not going to happen. Negativity आएगा, positivity आएगा, वो सब बात की बात है. छोड़ो उस चीज़ को. 10 दिन हमने इतनी जोर से मेहनत करनी है कि यार हमारे से बेटर ना कोई मेहनत कर पाए. और जब वो चीज़ कर लेंगे, बाय द टाइम दैट यू आर एबल टू डू दैट, आई कैन एश्योर यू दैट धरती भी आपकी, आसमान भी आपका, अंबर भी आपका. यू विल गेट द रैंक ऑफ योर चॉइस, यू विल गेट द सीट ऑफ योर चॉइस. ओके, ये 10 days में हो जाएगा बेटा. आरुषि, नथिंग इज गोइंग टू स्टॉप यू. इफ यू थिंक यू कैन, डेफिनेटली यू कैन. ओके, सो आई विश यू ऑल द वेरी बेस्ट. एंड अभी कुछ नहीं करना, सोशल मीडिया से थोड़ा शांत हो जाओ. Take proper rest. Good sleep is the key. Okay, so take proper rest. 7 hours, 6 hours you should sleep all the time, and 6-7 hours के बाद आपको full productivity देनी है. 10 days अभी भी हैं. 10 days में पूरा revise करिए and keep yourself focused. Have a very good night. Thank you so much बेटा.